Santiago, and I would like to present my attitude assessment tools, which I will be using for our ophthalmology clerks in the De La Salle University. As a background, we've been teaching year level 4 students in De La Salle. This is a 2-week rotation, and we have OPD and operating room exposures, and most of the course objectives are focused on the cognitive and psychomotor skills. There is some attitude objectives like the expected Lasallian graduate attitudes, which includes competency, compassionate, and safe physician, or that an outcome that the student will become an effective communicator, a reflective lifelong learner, an innovative and efficient manager, and ethically and socially responsive individual. However, these are our teaching and learning activities. They include patient encounters in the outpatient department, preceptorials with consultants, small group discussions, bedside rounds for inpatients, and a disability simulation or blindfold experience. No, it's only the actual patient encounters and blindfold experience that we can use to develop the attitude of our students. Um, I would like to tell you that although we included the disability simulation experience in our instructional design, we never uh, we never actually performed it in we never did it in actuality, and there was no assessment of this activity at the end. And it's a good thing that we're doing attitude assessment in this our class, because I think it will help us a lot. Um, the patient's narrative in actual patient encounters can be extracted by the students while they're doing the interview. However, aside from extracting the narrative about the disease progression, in this case, the eye problems that have resulted to blindness, they should also be able to extract how these problems affect the patient's daily lives and their mental health, and how they perceive their future, no, without their eyesight. Experiential learning can be done through disability simulations naman. An example of this is dividing the clerks in pairs and blindfolding one while the other one tries to assist him to go to the bathroom or the dining table, and then vice versa. The disability simulations are effective methods of teaching empathy, but it is, if not done carefully, it can give a distorted impression of blindness, like reinforcing negative misconceptions about the capacities of blind people. Therefore, it must be done in congruence with activities that have meaningful contact with blind people, such as regular exposure to the patients in the ophthalmology outpatient department. In mind, I have revised the effective learning objectives for the rotation. So that at the end of their ophthalmology rotation, the clerks would be able to discuss their perception of visually impaired individuals' inner experiences and natural feelings, and contrast the daily life of persons with visual ability from those without. Number three, verbalize to the patients that they can understand their feelings and perspectives. Number four, influence their classmates, friends, and family to actively seek a deeper understanding of the plight of visually impaired patients. So, let us go to the activities. As I've said, no, there are two activities: the patient encounter, and the blindness disability simulation. It has been shown that training courses in communication skills and patient-centered care with different teaching activities such as didactic lectures, reflective and interactive workshops, and encounters with simulated patients improves the ability of students to explore patients' illness experience better, showing more empathy in a genuine way. In De La Salle, such training courses are not given as separate activities. They are usually incorporated in the curriculum or instructional design of every specialty department. Since this involves actual patient encounters in the OPD, there must be a more conscious effort by the ophthalmology faculty to teach patient-centered care and proper communication during the clerk's actual face-to-face encounter with patients. To deepen the students' understanding of the patient situation, these questions will be given to them to ask to their patients. For example, they will ask, how do you go about your daily activities in the house? How do you feel about that? What are the things that you miss doing? How do you feel or cope about that? No? Have you adjusted with this visual impairment? How? In what aspects? Have there been changes in your relationship with your housemates? In what way? No? Like, are there more um, dissonance in the house? No? How do you see yourself in 1 to 2 years? Okay. Other probing questions may be asked depending on the patient's openness to answer the clerk. The second activity is the disability simulation for the visually impaired. Actually, this should be the first activity and it should be done at the start of the rotation. No? And this is a 30-minute activity wherein the class of usually 8 to 10 students will be divided into pairs. And as I've said, no, they will do, one will be blindfolded, the other one will be assisting. And these are the instructions. After that, role playing, no, there will be a plenary session wherein each student will be asked to share their thoughts, feelings, realizations, and insights about the activity. Okay, the it will be noticed that both these are my assessment tools. I will be using an EJournal and a state empathy scale, which is a 7-point Likert scale. This the second one I made it. I'll show it to you. It will be noticed that both are self-reporting inventory assessment tools. No, a mixture of methods of assessment would be better, such as including observational techniques. However, this method of assessing the student would be impractical for us since it requires multiple encounters and observation by the consultant in charge of the ophthalmology clerkship program. Uh, because the students rotate every 2 weeks and there are new students every 2 weeks and it's going to be a bit heavy on the side of the consultants. We are only 9 in the faculty. So for the e-journal, no, Gibbs said that it is not sufficient to simply experience something in order to learn. Without reflecting on that experience, it may quickly be forgotten. No, and the e-journal is the perfect instrument for reflecting. The Gibbs Reflective Cycle is meant to be a structured debriefing in support of experiential learning, either for a single or repeating experience, making it a perfect method for clinical clerks. So here, listed down, is the Gibbs Reflective Cycle. We all know this. Okay, this is what I am going to give to my students so for them to write their e-journal. First is the description. No? On the right side column are the questions that I have formulated that they will be answering and to be included in their e-journals. No? So included will be with whom was your encounter with? What were your patient's concerns? No? Did you encounter other patients with similar disabilities during your rotation? Can you tell us about that too? Ganyan. And on the left side is how they will be rated, how their e-journal will be rated. For example, an excellent entry would include clearly articulated narrative with sufficient details, focused on the more significant details. Two, feelings and thoughts about the experience. Um, these are the guide questions on the right. No, is this the time you've talked? Is this the first time you've talked to a visually impaired person? How did you feel while listening to her? Can you expound on the emotions you felt while the patient was narrating her story? Were you able to relate to her story, and how? Did the blindfold disability simulation help you understand their situation? How did you feel when you were listening to the third patient with visual impairment? No, so this is an summative um, listing or expression of the student's experience, no, analysis for all the patients that he or she has interviewed in the during the 2 week rotation in the OPD. Again, on the left side is the scale for through which we will be grading our students. No, an excellent answer would include description of the feelings and thoughts during and after the experience, was clearly articulated, was expounded, focused, and well organized. For evaluation experience, these are the questions, no, on the right side. Did the blindfold disability simulation help you empathize with the patient during your interview? Did you have sufficient encounters with visually impaired patients to help you understand about their everyday challenges, and so on and so forth? For the rating, an excellent answer will have an answer that is related that has related the disability simulation exercise with his patient experiences, and gave sufficient positive and negative remarks, and gave well thought suggestions and recommendations. For analysis, these are the questions. An example of which is how is this experience related to your current context as a student? No? And how did this experience affect your current attitude toward the visually impaired? An excellent answer would mean that he is able to verbalize his attitude deficiencies and how he can utilize the whole experience in developing his attitude toward visually impaired patients. For the conclusion, he should be able to answer these guide questions, no? But not limited to this. What are your new learnings from the encounters? What knowledge or insights were reinforced by your experience? An excellent answer would be something that has extensively and clearly described his learnings and insights. And he was able to identify and discuss what attitudes or attributes are needed to further develop them. Lastly, for the action plan, these are the guide questions. An example is what were you challenged to do after the disability simulation and your patient encounters in ophthalmology? And how do you plan to apply the learnings from your experience to yourself and to others? No? An excellent answer would have clearly defined plans for self, community, and society that are doable with time frame and measurable. Expressed desire to improve specific attitudes that are important for him as a future doctor, and made specific plans how to do so. Okay, so that is the first, no, yung EJournal. Let's go to the second assessment instrument, which is the state empathy scale. No, this is a self-administered questionnaire. It has 13 statements to which the students can agree or disagree, and I chose a 7-point Likert scale for this. I have already put this in the I've made a Google uh, form, no, for this, and it's already posted online. The students will be instructed to base their answers on the two activities. This online questionnaire can be administered on the last will be administered on the last day of the rotation. It will be open for 24 hours only, and will allow for which they so that they will be allowed to choose a time that they are not rushed, that they can think and reflect before they answer the questionnaire. The maximum score is 91, which is 7 times 13. the passing score is 65. However, there is no really passing in effect because this is attitude. However, any score of 3 or lower in 4 or more of the statements may warrant a one-on-one mentoring session with the student. An example of the question is of the statements are: I can see the visually impaired patient's point of view. I recognize the patient's situation. I can understand what the patient was going through. The patient's actions and attitudes in the given situation are understandable. No? For the affective, that was for the cognitive, the first one. For the affective, these are the statements. The patient's feelings and emotions felt genuine. I was able to experience the same emotions as the patient while she was telling me her story. I was in a similar emotional state as the patient was when she was relaying the lowest point in her life. I could feel her emotions, her desperation. For the behavioral part, these are the statements. I wanted to touch her a bit as she was telling her story. I allowed her to talk as much as she wanted about her feelings during the interview. I listened to her intently to show my concern. I used a low and somber tone whenever it was necessary, not rushed. I proceeded with my ophthalmic examination only when I felt she was ready and after asking for her permission. So, thank you for listening. Those are my assessment tools for attitude for the year level 4, and these are my references. Thank you, everyone, and Merry Christmas.